is Dr. Emma Nichols, and this is the information on the latest US FDA approvals for May 13th through May 17th, 2024. The FDA has granted accelerated approval for tarlatamab-dlle, also called Imdelltra, to treat adult patients with extensive stage small cell lung cancer, ES-SCLC, who have experienced disease progression on or after platinum-based chemotherapy. SCLC, small cell lung cancer, accounts for about 10% to 15% of all lung cancers and is known for its aggressive nature, with a median survival of about 12 months following initial therapy and a 3% 5-year relative survival rate. Imdelltra is a first-in-class delta-like ligand 3, DLL3, targeting bispecific T-cell engager, or BiTE, therapy, making it the first bispecific antibody approved for extensive-stage small cell lung cancer. This agent targets CD3 on T cells and DLL3 on small cell lung cancer cells. The accelerated approval was based on results from the Phase 2 Delphi, that's DELLPHI 301 clinical trial, which included 220 patients with advanced small cell lung cancer. Imdelltra demonstrated an objective response rate of 40%, a median duration of response of 9.7 months, and a median overall survival of 14.3 months. The approval of Imdelltra was granted to Amgen. Also last week, the FDA has granted accelerated approval to lisocabtagene maraleucel, also called Breyanzi, which was previously limited to relapsed refractory grade 3B follicular lymphoma. Breyanzi was also approved for relapsed refractory B-cell lymphoma and lymphocytic leukemia. This agent works by genetically modifying a patient's T cells to express chimeric antigen receptors, CARs, that specifically target tumor antigens. Follicular lymphoma is a non-Hodgkin lymphoma characterized by slow growth and often presents with relapses after initial treatment. The new approval was based on findings from the Phase 2 single-arm TRANSCEND FL trial, which involved 94 patients with relapsed refractory follicular lymphoma after 2 or more lines of systemic therapy, including an anti-CD20 antibody and an alkylating agent. Patients in the trial received a single dose of Breyanzi 2 to 7 days after completing lymphodepleting chemotherapy. The overall response rate was 95.7%, and the median duration of response was not reached after a median follow-up of 16.8 months. The approval of Breyanzi was granted to Bristol Myers Squibb. The FDA has granted a fast-track designation to an agent called SNB-101 for the treatment of patients with small cell lung cancer. SNB-101 is a polymer nanoparticle anti-cancer drug currently undergoing evaluation in clinical trials and is the first nanoparticle formulation of the anti-neoplastic agent SN-38, an active metabolite of irinotecan. SNB-101 incorporates SN-38 into polymer nanoparticles, enhancing its delivery and efficacy specifically to the lungs. Early data suggests improved tolerability and lung-specific efficacy with this agent. Global clinical trials are expected to begin later this year upon IND approval for Phase 2 in the US and Europe. Beyond small cell lung and pancreatic cancers, SNB-101 holds promise for a broader range of solid tumors. The fast-track designation was granted to the Korean company SN Bioscience. Also last week, the FDA has accepted for filing the Biologics License Application, BLA, for elodosagene exuparvovac, also called Upstaza, and that's a gene therapy for the treatment of aromatic L-amino acid decarboxylase AADC deficiency. The application has been granted priority review with a PDUFA target action date of November 13th, 2024. Upstaza is a one-time gene replacement therapy indicated for patients aged 18 months and older with a clinical, molecular, and genetically confirmed diagnosis of AADC deficiency with a severe phenotype. It utilizes a recombinant adeno-associated virus, AAV, serotype 2-based vector to deliver the human DDC gene directly into the pitumen, thereby increasing AADC enzyme levels and restoring dopamine production. AADC deficiency is a rare and fatal genetic disorder that severely impacts physical, mental, and behavioral functions from the first months of life. The efficacy and safety of Upstaza have been demonstrated in clinical trials and compassionate use programs since 2010, showing transformational neurologic improvements. The most common side effects include initial insomnia, irritability, and dyskinesia. Administration of Upstaza is performed via a stereotactic surgical procedure by neurosurgeons in specialized centers. The approval of the BLA for Upstaza was granted to PTC Therapeutics, Inc. And now a word from the supporter of this podcast, Nascent Medical. Is your company in need of medical writing assistance? Visit nascentmc.com. That's nascentmc, as in medical communications.com. Our native English-speaking MD and PhD level medical writers create fast turnaround needs assessments, medical news pieces, manuscripts, slide boards, ad board summaries, and much, much more, all for the price of a single freelancer, but with a much wider selection and with a background in the specialty that you need. And they're always available. Nascent Medical, we're here so that you never have to be without excellent medical writing help. Also, last week, the FDA approved an updated label for the anti-hemophilic factor recombinant FcVWF-X10 fusion protein EHTL, more easily pronounced as Altuviiio, now including the full results of the Extend Kids clinical trial. And the phase 3 study demonstrated the effectiveness of a once-weekly Altuviiio dose in providing bleed protection in pediatric patients younger than 12 years with hemophilia A. Initial approval for Altuviiio was granted in February 2023. The drug, previously known as efanesoctocog alpha, is a first-in-class high-sustained factor VIII replacement therapy indicated for both routine prophylaxis, on-demand treatment to control bleeding episodes, and perioperative management for both adults and children with hemophilia A. The agent works by extending the half-life of factor VIII, thereby providing prolonged protection against bleeding. Hemophilia A is a genetic disorder characterized by a deficiency of factor VIII, leading to impaired blood clotting and increased bleeding risk. The safety profile of Altuviiio in Extend Kids is similar to the safety profile demonstrated in the Extend-1 clinical trial. The approval of Altuviiio was granted to Sanofi. Also last week, the FDA has approved the BD OnClarity HPV assay for the use of self-collected vaginal specimens for HPV testing when cervical specimens cannot otherwise be obtained. Previously, the BD OnClarity HPV assay was approved for HPV primary testing without the need for a traditional pap smear performed with a speculum. HPV is the cause of virtually all cervical cancer, making HPV testing the preferred screening method by the American Cancer Society in the U.S. The BD OnClarity HPV assay identifies 6 individual HPV strains, offering a precise method to assess a woman's risk for cervical precancer and track these strains over time. The approval of BD OnClarity was granted to Becton Dickinson. Also last week, the FDA has approved an expanded indication for clinolipid, lipid injectable emulsion, to be used in pediatric patients, including preterm and term neonates. Clinolipid, a mixed oil lipid emulsion, provides calories and essential fatty acids in parenteral nutrition, where oral and enteral nutrition is not possible, insufficient, or contraindicated. Clinolipid has been available in the U.S. since 2019 and is now, as a result of this approval, approved for use in all ages. The approval of Clinolipid was granted to Baxter International, Inc. All right, that's it for this week. Thanks so much for listening. If you're interested, and you're listening actually today that this podcast comes out, the AIMWE AI in Medical Writing and Editing course is available now for sale until tomorrow, Tuesday. And this will be available at learnamastyle.com. That's learnamastyle.com. And this is a transformational program that will help you implement AI into your workflow as a medical writer or editor. So that's not everybody listening, but if you're a medical writer or editor, or even if you write about these topics, then definitely check that out. It's at learnamastyle.com, transformational program to implement AI in your writing process. All right, thanks so much. I will be back next week with the latest information on the new FDA approvals. Thank you.